12 minutes past the hour, and tonight, as we continue to focus on Heart Month, we want to show you something new that's helping the most vulnerable of patients.
Our senior health correspondent Monica Robbins gives us an exclusive in-depth look at the new pediatric cardiac intensive care unit at Rainbow.
Little Cody Waldron is among 1% of babies born in the U.S. each year with a congenital heart defect. At 5 months, he underwent open heart surgery. He won't remember being the first patient in Rainbow's new cardiac ICU, but his parents certainly will.
The new unit is so bright and so inviting and so hopeful.
Just the atmosphere alone was much different. I mean, it was definitely a lighter feeling. Everything was bright and they got more comfortable.
Dr. Ira Scheifetz is chief of cardiac critical care. His team designed this unit from scratch with input from those who work here and what families say they wish they'd had. The rooms are large with sleep and workspace for parents. Every room has a window.
It's just so important to maintain the normal diurnal variation. Days are days and nights are nights. There's a really well-known entity called ICU delirium, where patients' brains get miswired, is just a way of describing it, because they don't have normal cues of morning and night. There's all the noise, the stimulation, and they literally become delirious.
Light can be a stress reliever too. That's what these rooms are for.
To get away from just the stress of an ICU, but not go far. That's what we heard from the families is, we know sometimes we need to step out, but we're not comfortable going downstairs or going elsewhere. We want to be close.
When it comes to care, it's hard to miss.
And everything was designed on line of sight. Families can see their child. Staff, wherever you are, you can see in the patient rooms. And if you're in the rooms and need help, you can see out.
Which is also reassuring that you have eyes everywhere at all times, no matter where anybody is in that unit.
Even nurses that may not be your specific nurse could see everybody's monitors at every time.
Multiple room monitors visible from every corner. If one turns blue, nurses know exactly where to go. It's what you don't hear that's different.
We designed the unit to be able to be sound absorbing. So it's quiet, there's not a lot of alarms, not a lot of announcements. It's really quiet to really avoid that unnecessary stimulation.
Another unique feature is the prescription pass-through. The pharmacy delivers medications right to the patient's room, so the nurse doesn't have to leave the bedside.
Another unique aspect about this is that Rainbow partnered with Nationwide Children's Hospital in Columbus for the Congenital Heart Collaborative, meaning for the most complex cases, doctors at both hospitals are taking a look at that case. And if there's a staffing issue, they can pull doctors from either hospital.
Creating a unit like this is important because cardiac patients often need longer intensive care. As for Cody, after 15 days here, he's home, and hopefully the only time he'll be back is to visit the nurses who took care of him. Monica Robbins, 3 News.
Oh, you know they would love to visit him.
Amazing story. Amazing.
That was awesome.
Great for Cody and his family.
Yeah.